And now for more in-depth analysis about the situation in the United States, we are now being joined live by Jagriti Dave from Washington, D.C. Jagriti, thank you so much for joining us. So it seems that the U.S. is facing its toughest week of this outbreak right now. And we are now hearing that it is the minorities like the African American or the Latino community that forms a majority of the death toll from this virus. So can you elaborate on this?
Yes, indeed. So what preliminary data from states is showing is that areas where there is significant African-American, where, say, for example, there is significant African-American community who are experiencing ill effects of the coronavirus. So they are in places like Michigan, for example. The proportion of African-Americans is lower compared to the percentage within the grouping that are getting the virus and are dying of the virus. And this is something that Dr. Anthony Fauci, member of the task force, one of the US's top leading infectious diseases experts, addressed, as well as the president, saying that there's clearly issues with disproportionately issues that affect access to healthcare, etc. But also there's comorbidities that these communities experience more, such as diabetes, such as asthma. And so asking them to especially be careful maintaining the social distancing, for example. But anecdotally, people are saying that there's also issues because these community members are the ones who actually end up in these jobs, which are considered essential workers. So they are the ones who can't stay at home, for example, because they are the people who work in shops, and they are the people who work on the front lines in that way. And this is preliminary data. There isn't enough data that is amassed to conclusively prove this. But this is something that the president said that they are going to get data on over the next few days to show exactly the racial disparities.
Right. Now, as we also know, the United Nations Security Council met just a couple of hours ago with all the permanent members and welcomed a global ceasefire. Now, is this meeting a tad bit too late, and should the body have met earlier, in fact?
This is, in fact, one of the criticisms that the UN Security Council were too late to have this meeting to really grapple with the pandemic. The Secretary General called it a public health, a national health, a global health crisis, a national security issue that this global health crisis is. And yet they were beset by tensions within the council, within members of the council. You mentioned the tensions between the US and China about the origins of the virus, China accusing the United States of scapegoating and politicizing the virus. There are calls to end global conflicts while this pandemic is going on, which needs to be backed by all members of the council to go through. But they are trying to do something, but they have been criticized for not doing it fast enough.
Right. You know, as you just mentioned that during this UNSC meeting as well, the US and China continue to level these veiled attacks on each other about the origin of the virus. So how do we see the relationship between the two countries unfolding in the coming months?
It's difficult to say. The US-China relationship has had its ups and downs over the last couple of years, really, when you look at the dynamics regarding the dispute on trade that they've had. When it comes to negotiations, there is no resolution between the two, but then President Trump goes in front of the cameras and says very complimentary things about Premier Xi, his Chinese counterpart. So it's very difficult to really predict what goes forward. On the one hand, the president has complimented China on their response in tackling the coronavirus pandemic. But then on the other hand, the President Trump only recently has criticized the World Health Organization for what he described as being too China-centric. So again, the relationship between these two nations continues to be unpredictable.
Right, Jagriti, thank you so much for joining us and for all your inputs.